guys get your lunch, please be eating as we start, and we'll get rolling here. All right, again, welcome. We're back with our second Synergy of the fall. Again, reminders, these are once a month on Thursdays. So go ahead and mark your calendars for the rest of the fall. And into the spring, we'll go 11:15 to 12:15. There'll be lunch provided, please eat. We talked about that last time. And just kind of set your calendars there. Today, we got some cool people on our crew talking today. We've got a rep from Athletic Performance and Football, Corey Campbell, and Juliana Buzzard from Sports Nutrition. And they're going to kind of talk about day-to-day things that they do within our program and what makes them great, and basically the reason that they're here as a professional at Baylor. So really looking forward to that. A couple of things this weekend. Going to encourage everybody to follow along with what's going on. There's a lot of stuff going on campus, a lot of things going on. Teams traveling. We got women's soccer going to Morgantown, going to Ames. We got volleyball up in Kansas. Kansas State's here with football. And then we got both the tennis programs. Women are here with the HEB tournament. Free admission. Come on out and support those guys. And in the men's tennis program, they got 2 different sites that they're working on through this week and then at the beginning of next week. So if you're unable to attend these events, would certainly encourage everybody to know what's happening, even if it's a team you're not working with. Know the score, understand kind of the result, and then if you see that student athlete walking through, just engage them and say, what's up? Great event. I saw you guys won. That's great. Tell me a little bit about it. Certainly a great opportunity to engage with some of our student athletes. Okay, so we'll take a few minutes at the beginning of every one of these to just kind of go around within our different departments and give just like a brief update. Floor is open. Anytime that you need, we'll kind of go. We'll start at the top with mental health services and Ms. Monique.
Good morning. I cover is Depression Awareness Month, so just be aware of that. I am available to come talk to your team for 30 minutes, an hour, 15 minutes, however long, particularly this month about depression, but any topic that might be suited for your team. Also, just reminders that student athletes might be referred to other services. So remember, right now, Athletic Mental Health Services is me. So with all of the athletes that we have, they're coming in using the services, which is great, but be aware that they may come back and be like, well, I had to go to the counseling center or to Dr. Corley or something, and that is because Athletic Mental Health Services is me. So I think that's important for you all to be aware of. So if your athletes come back, you can explain to them why that is, even though I will. But just those are the things that are happening and things to remember.
Thank you, man. We'll go with athletic performance. Coach.
Midterms happening this week and the last week, beginning of next week. So just keep that in mind as you're interacting with the student athletes. Sorry that the gym was a little too small, but it's funny. Yeah. I want to remind everybody that the weight room over in Hires is open for staff training between 11 and 1 p.m. Monday through Friday. It's been awesome to see a few people take advantage of that and keep ourselves healthy and well. And then the last thing is we're going to be doing some class presentations for a couple of the HHPR classes over the next couple of weeks. So one graduate class, one undergrad class. And we use these for lead-ins and kind of advertise speed, power, and agility strength training class that we teach in the spring. HP 53, 55. It's a grad level class. If you have any students in your area that are pretty sharp and maybe in that junior senior category as an undergrad or if they're in graduate school, feel free to recommend them to that class if they're going to be working in a performance environment, sports medicine environment, even a nutrition environment. It would be a helpful class for them, but you get that rolling in the spring.
Appreciate it, Coach. Sports nutrition.
Where's our slide?
I didn't get one.
Hi, my name is Jeremy Chen, and we have Timothy Video and Juliana Buzzard. And today we're gonna have the lecture series about eating disorder, and stay tuned.
Back to athletic performance, Coach Scott.
We're good.
Coach Shadid.
We're good.
Good. Coach Melton, good to go?
Rocking and rolling.
All right. Sports medicine. Where's Dave?
we've got a lot of things we're excited about right now. Nothing super new for the staff outside of the student athletes, but we have our electronic medical record software up and running now. So Matt and Carrie have been working really hard at building that out. Everyone else has helped, so we're really excited about getting started and underway with that to be able to do a better job at data input and tracking. And we've also got some of our new competitive software that we're going to start transitioning over to in the next year with all our student athletes, which I think will help us out a lot and help us in our communication. But a lot of computer technology things that is not my forte, but that's why we have everybody else.
And I'll talk. And then from an applied performance standpoint, certainly try to looking at some different data management within our teams. Like Dave said, our AMS software, we're looking at an API. APIs are simply little programs that send data to this big cloud software. So we're streamlining those along with Coach Rath and Coach Altoff. Really pushing sleep education and wellness education out and focusing on balance, everything in our life being balanced. And then something in the horizon with all the plastic products that we can that we use in our different weight rooms and our facilities, we're kind of looking at some ways we can kind of give back and recycle those in the form of education there with those guys. Another little announcement, we will have some flu shots available. They're up in the second floor athletic director's conference room right beside Coach Mack's office up there. And basically this is working with campus-wide challenges. This little girl in 2003, real fast, contracted the flu, and it kind of spun out of control, and she actually passed away. And because of this, her family started this foundation, and it morphed into college challenges. So a lot of different hospital organizations and universities across the country are involved in this, and essentially they're trying to provide as many flu shots as possible. This goes from students to staff, even fans that get a flu shot and want to log onto this system and put in their name for Baylor. So again, this is kind of a challenge, but more importantly for people like this and our student athletes, think really hard about if you'd like to get that immunization. And they are available up near Coach Mack's office on the 16th of October from 11:30 to 1:30. It's important to note that these are first come, first served. There's not a ton of them. So if you really want those, go up there on that day. All right, today we got two guest speakers, one Corey Campbell and Juliana Buzzard. Both of them are extremely dynamic young professionals in our crew here in health and wellness. Juliana, she came by way of Utah State University and the University of Alabama. And if you get an opportunity to watch Juliana work down in the weight room area around nutrition at the bank, it's awesome. She's always buzzing around doing a lot of things. She's never stopped working since she's been here. And I think one of the cool things about her too that's super important for us in being professionals and working with athletes, she's always positive. That really rubs off on our student athletes every single day. So, Juliana.
Thank you, Coach Nelly. So today we will be talking about eating disorders. So just a little bit of outline. I'm going to kind of lay out what eating disorders are, the serious ones, kind of some disordered eating behaviors, and then we'll talk a little bit more about athletes specifically regarding the female athlete triad, the medical workup, and kind of what return to play might look like in that aspect, and then how this applies to everyone in this room. So I want to start with anorexia nervosa. So anorexia is basically an obsessive fear of weight gain. You have a distorted body image, and it's refusal to maintain a healthy body weight. So this actually is the highest mortality rate of any mental illness anorexia has. And then there's a lot of health concerns that can come with anorexia. Amenorrhea, that's more than 3 consecutive missed periods, so it can disrupt hormone levels, and that's male and female hormones, not just female here. It can lead to osteoporosis or decreased bone mineral density. Can have issues with gastroparesis, so that's basically your GI tract stops, moving things through it because there's not enough food coming in. And then dysphagia, that's when your esophagus, basically the muscles that we are all using right now to eat, like swallowing that, stops working. So, it's kind of like a use it or lose it situation. You can get muscle atrophy in your throat, and then can lead to many cardiovascular risks, kidney failure, liver failure. And then refeeding syndrome at the bottom, that's something that can happen when someone is in treatment and then they are refed too quickly. So everyone's body adapts, and it adapts when it's kind of in a starvation mode. So essentially what happens is if you're refed too quickly, your body can get an electrolyte imbalance, so it's starting to, build protein, build fat, build up your glycogen stores, so it's gonna use a lot of your electrolytes like that, and so that can happen. So that's typically like phosphate, potassium, and magnesium. Next, I want to talk about bulimia. So that's patterns of binging and purging. It's not just making yourself throw up. This could be diuretic use. This could be laxative use or excessive exercise. So, you binge and you eat a giant meal, and then you have to make up for it by spending the entire day running at the gym. And then there are a lot of things that can come with bulimia. One of them is it can cause GI distress. So from over laxative abuse, like your body's not able to run normally. Electrolyte imbalances again, hypokalemia, that is low potassium. So sometimes someone could tell you like, hey, I'm not purging, I'm not throwing up, but you look at their electrolyte panel and you can see they have low potassium. And then edema, that's basically swelling, you're very swollen. Fluid retention can happen from throwing up as well, and then with the throwing up stomach acid, so your esophagus can get inflamed, your teeth can start to decay, and there are some other like visible effects that can happen, like people's knuckles can get abrasions from making themselves throw up, So these are all very serious eating disorders. And then binge eating disorder. So, for binge eating disorder, I put a little more specifics about this just so everyone knows, kind of understands. It's not just overeating at one meal. It's essentially a loss of control. So it's frequent binging. This is the official diagnostic quality for it, but it's at least once a week for 3 months, combined with a lack of control, extreme distress, and then 3 or more of the following behaviors. So that's eating more rapidly than normal, eating until you're uncomfortably full, eating large amounts of food even when you're not hungry, eating alone because you're embarrassed about what you're putting into your body, and then feeling disgusted with oneself, essentially because of your lack of control, so you feel guilty from what you've done. And the medical complications of this are medical complications that are associated with obesity, so that's like high cholesterol, heart disease, hypertension or high blood pressure, and then diabetes. And then I just want to talk about some other things that you guys might not think of when you think of eating disorders. These are more like disordered eating behaviors. So ARFID is known as avoidant restricted food intake disorder. So it's like you avoid certain foods because of their texture. You are aversive to food because it's fear-based. So let's say one time mac and cheese hurt your stomach, you will never eat noodles again for the rest of your life. You're afraid of any type of pasta. And then restrictive, so you just don't eat because you just aren't interested in food. So this is different from like, let's say anorexia, because it's not based on body image or thinness. It's not because you don't have access to food, it's just you just have no interest in it. But again, with this, you can get severe malnutrition from not eating and not eating certain food groups. And then OSFED, that's other specified feeding and eating disorders. So I put orthorexia on here. That's not an official diagnosis yet. However, orthorexia is just basically obsessed with clean eating, quote unquote, avoiding unhealthy foods. So it's like you can't eat bad food, but as dietitians, that no food is bad food. It's everything in moderation. So that's why this is kind of a disordered eating behavior. And then overexercise, exercise compulsion or obligatory exercise, body dysmorphic disorder, altered body image, and then diabulimia. So diabulimia is something that if you are a type 1 diabetic, you might manipulate your blood sugars to make yourself lose weight. So now I just want to now that we have a broad idea of eating disorders, I want to kind of touch on some myths that you guys might have heard or might think about eating disorders and jump into them. So people with eating disorders look unhealthy. That's not true. You can't always tell if someone is struggling with a relationship with food from the outside, especially because there's so many different types of eating problems that someone could have. Eating disorders are a lifestyle choice. It's It's not true. Eating disorders are a result of genetic and environmental factors. And then only females from upper socioeconomic status groups develop eating disorders. Actually, eating disorders affect everyone from all walks of life, males and females. And we'll get a little more into this, but in an athletic setting, like eating disorders aren't just in the sports you think of, like the lean sports. Eating disorders can affect anyone, any of our student athletes. And then eating disorders are based on food and weight issues. That's not true. Eating disorders is a mental disorder, so there's a lot of other issues going on in that regard. And then full recovery is not possible. Some people think if you have an eating disorder that you will have it for the rest of your life. Full recovery is possible. So now, kind of shifting gears towards more of an athlete base, I want to talk about the female athlete triad. So the female athlete triad has kind of changed in recent years. So it's not just a triangle now, it's a 3D triangle. So in the past, it was just like disordered eating, osteoporosis, and then amenorrhea or lack of period. Now it's kind of like a spectrum. So it's any type of energy availability issues with or without disordered eating, any type of bone mineral density issues, so low bone mineral density all the way up to the osteoporosis spectrum, and then any type of menstrual issues. And then I want to talk about relative energy deficiency in sport, or REDS. Some of you might have heard it. So this is kind of what they've gone to encompass everyone, because the female athlete triad is not including about half of our athletes here. So you can see the red triangle in the corner that is connecting REDS, relative energy deficiency, bone health, and menstrual function. So it still is included, but it's more of a broad spectrum and shows kind of all the areas that having relative energy deficiency can impact. So just want to talk a little bit about the medical management of athletes that might be at risk for relative energy deficiency. So who's at risk? All our athletes are at risk. It's not just, like I had previously said, it's not just the lean athletes or the body image sport athletes, it's everyone. And typically what happens is there's a full workup that needs to be done on these individuals. So that can be a medical history, looking into their injuries, looking into their menstrual history, family history, mental health history, looking into their meal history, which would be done like working with the dietitian, how they've typically ate, if things have changed over time, and why, and then exercise history. Is this someone who struggles with overexercise? Are they compensating for something? Do they feel the need to go out and do more after practice with the team? And then physical exams. There's a lot of things you can notice about people by just looking at them. Their hair is brittle, their eyes are bloodshot, they look tired, they look sunken in, they have extra hair on their arms that they might not normally have if their nails are breaking. And then there's lots of labs and tests, so looking at electrolytes, hormone levels, vitamin D, blood levels, and then the bone mineral density. So it's kind of like a whole big picture so you can get a real good look before diagnosing someone with a problem like this. And then just talking a little bit more about the treatment, so who's involved, the team doctor is involved, the dietitian is involved, mental health is involved, the athletic trainer is involved. So just so everyone's on the same page. And then for return to play, basically if there's acute abnormalities on this workout, if they have a stress fracture, if something is going on, they will not be able to exercise. And then something that someone will get is a contract or a checklist for participation, so they need to be compliant with their appointments, so compliant with meeting with nutrition weekly or every other week, meeting with mental health. If they're making progress on their goals, maintaining or gaining weight, they're non-symptomatic and screened and cleared, then they can slowly be reintroduced to exercise. So that might start with 50% activity modification at a low intensity and then kind of work up with consistent weekly progress. But with that, I do want to talk about a realistic timeline for recovery. These are not things that happen overnight. They can be doing all the right things and it's still going to take time working with that athlete. So starting recovery of energy status, that can take days or weeks. It can take longer than that, depending on the individual and how they're working with nutrition and what is going on. But that is like the first thing that would happen, and then after that, recovery of menstrual status, which can take months, it can take up to a year, even after their energy status has been restored. And then recovery of bone mineral density, that process can take years. So I think it's important for everyone to know that these things don't happen overnight. These things take time. So just some signs and symptoms to look for with disordered eating behaviors. Again, if someone does this, it doesn't mean they have a problem, but it's just something to be aware of as we work with athletes. So if someone is consistently leaving the table every 10 minutes after a meal, if they're playing with their food instead of eating it, if they are skipping meals consistently, or they skip meals and then later overeat at another meal, if they have consistent fatigue problems, they're restricting foods or entire food groups, they express a lot of concerns about becoming fat, or they just talk a ton about food calorie intake, worrying about weight or weight gain, and rigid eating behaviors. Additionally, just wanted to touch a little bit on the male population. Sometimes people that struggle with a relationship with food, it might not be what you think of when you think of a typical eating disorder. So for the male population, this might be severe restriction of non-protein related dietary components, interrupting important activities to accommodate frequent eating, continued food consumption after feeling full, liquefying or blending food for easier intake, use of appearance-enhancing drugs, and then restriction of carbs and fats when training regimen was mixed. And again, this doesn't mean if you do see this behavior in someone that they do have a problem. It's just things to be aware of as you guys are working one-on-one with athletes. And I want to talk a little bit about support. So typically if someone is getting treated for eating disorder, the family is very involved. Here, like our athletes, they're away from their family, so a lot of us are their support system. So something that has been talked about is the externalization of the eating disorder. So it's easy for us to be like, well, like just eat or just do this, but everyone has an internal dialogue, and the eating disorder is controlling that for these people. So another thing is you want to accommodate. You don't want to accommodate their anxiety. You want to support them through it instead of taking them from it. So an example of this is if your child is going to kindergarten and they're crying and they're like, I don't want to go to kindergarten, you're not going to just not let them go to school. They're going to go to school, you're just going to be supportive of it. So what that might look like for us is if someone's complaining about going to appointments or meeting with nutrition, I don't think this is helping me, you could be like, well, you can accommodate them and like support them through that and let them know why it's important. You want to validate their feelings. So instead of like saying, I know you don't want to go see the nutrition dietitian this week, but you have to. You could say, I know you don't want to go see nutrition this week because you have a really big test coming up and you feel stressed about it, and then you go and support them, like support their emotional need by validating that, and then kind of redirecting that and being like, maybe I can work with you on scheduling and studying for your test at this other time so you can make this appointment. And then just application for everyone in the room. So it's important to know the signs and symptoms between the eating disorder and disordered eating behaviors, and recognize and report potential red flags when you're around athletes. This could be comments they're consistently making in the weight room, behaviors in the locker room, talk from teammates, but it's important for everyone to kind of understand that eating disorders are extremely serious and take necessary action. And then understand a realistic treatment plan timeline. So recovery of energy status can take weeks. That's not something that might happen overnight. Recovery of menstrual and hormone status could take months. And then recovery of bone mineral density status could take years. So now I want to invite Tim and Jeremy up if you guys have questions to ask the three of us. Any questions?
From everything you just talked about, do you have any idea what percentage of Baylor student athletes have these problems? Or is there a national average or student athletes?
Well, there's a difference between like a diagnosable eating disorder and like a potentially a relative energy deficiency. So I'm not sure the exact percentage. I can look on that. I'm not
a much smaller percentage than what's actually out there, just because they're not always things that come to the forefront, especially in male populations, like females, maybe a little bit more comfortable going to someone and talking about that, but as far as the research goes, there's not a whole lot of incidents or prevalence, notified male athletes, but, here we do like a pre-participation screening to kind of get some of those questions answered, so that if we do see a red flag, we can have that conversation with the athlete here, kind of catch it before it develops into a full-blown disorder.
No question. So a lot of these athletes come here because they ultimately have been playing their sport since they were 5, 6, 7, all of those things. So then they come in here. How do you go about managing, especially from a lot of the Reds cases, when it talks about energy availability? A lot of the times you're dealing now with school, you're dealing with a different coach that you might not have had in terms of high school, so the load might be up there. You're dealing with athletic performance. So how do you go about managing that component along with everything else, so they can still participate in their sport and still be able to manage that, but then also not managing the fact of potentially always having to come in and do extra things, maybe getting certain blood work and making all those stresses that kind of might ramp those up, that might not make you feel better as well.
Yeah, great question. Thanks, Stacy. I think I think with that, number one thing is having a relationship with the dietitian, your team dietitian, and being able to work with them. And kind of that's on the dietitian to make sure that they are getting as much things that they can get. As a sports nutrition department, we have a ton of stuff that we can provide our athletes, so it's utilizing those resources and making sure that that athlete understands what their body needs, and then assisting them with getting it by using some of the resources we have in the department. Yes.
I thought a point to highlight that we discussed yesterday, or someone asked the question, was that if somebody has an eating disorder, are they just seeing you? We talked about like the whole,
Yeah.
that it's not just okay to just go see Juliana, they also have to go see Monique. They can't just go see Monique, they have to go see Juliana.
So, yeah, it's a huge picture. The athlete needs to make sure that they are seeing the dietitian that's associated with their sport, and then also mental health. Dr. Marshall is awesome, and this is a mental illness, so the mental health aspect is huge. And then that's something that is coordinated between mental health and nutrition, as well as the whole care team.
I think that's a big point to bring up too, because a lot of times, dealing with an athlete who has an eating disorder, a lot of times you just think like, oh, just eat food, like, why aren't you eating? But you have to look at like, there's a reason why. Like, the athlete knows what they need to do. The athlete knows like, yeah, I need to eat food, but there's more of that mental piece that's blocking them from being able to do this. That's where Monique is crucial in kind of working the athlete through that, so they can overcome whatever is preventing them from, eating appropriately, so that we can then address the food piece. We can't address the food piece without the mental health piece being kind of activated first. As much as it might seem like an easy fix, it's really not.
How often does athletes' deception play a role in this? Is that a frequent thing, or is that, just them just flat out lying to us, you, me, whoever?
Yeah.
Because you don't know anything about
Right.
amenorrhea unless they tell you, probably. So.
Right. And I think that's when the care team comes into place, because they could be sitting one-on-one with nutrition and telling them one thing, and then the coach and the athletic trainers on the trip are saying another thing. Like, I actually sat down with them at these meals. This is what's actually happening. They might be telling Dr. Marshall something in one-on-one. So that's why this care team meeting is so important.
So also, in addition to that, it's when athletes have any physical with the team doctors, the doctor can also do the blood work screening panels, and also can help us spot on something. It's like, this is a severe and serious issues, but do we need to freak out? No, we don't have to, because we have a great staff right here. You have trainers with them one-on-one every single day. You have a strength coach, so coaching them lifting and the time with them, and also we also work around with them. So it takes a lot of effort to help us to collect the information, but it don't need to make such a big deal, but we need to be aware of what information they provide to each other. Also, we know that teammates talk to each other. Whenever you collect information, those are crucial. Those are very helpful for us to get an idea, to get to know them. And then we always cooperate with Dr. Marshall, Dr. Myers, just to find out the best way solution. and then now the carries in that part of the meeting as well. So it's like, yeah, it's like we try to find the best for the athlete, what's the best treatment and what we can like spot on earlier at an early phase and prevent things getting worse. Yeah.
Yeah, I think a thing with having the collaborative conversation is being able to catch some of these things, people that might fall into the cracks. And, you know, if we're able to catch the athletes earlier, then we can prevent them from, you know, getting to the point. Any more questions? Thank you, guys.
All right, next up, we got Corey Campbell, athletics performance coach for football. Corey, University of Georgia graduate, spent time at Purdue University and University of Cincinnati. A couple things about Corey. You watch this dude work, just like Juliana, always doing something, always trying to find some ways to get better. Personally, I steal things from him on a day-to-day basis, especially with how he deals with athletes, builds relationships with athletes. You see when they come to him, they want to talk to dude. So that's huge. We got to be able to talk to our athletes in order to teach them, and this guy's a master at that.
Thank you, Nelly. I appreciate that. Really thought out introduction. Coach Roof, I want to give a shout out to your little gift. That was me last night trying to get this PowerPoint to Nelly. So, but today I'm going to talk with you guys about forming relationships with your student athletes.
Hit that little right area.
Guys, all right, do you understand your impact? As professionals, we need to be very competent in our given trades, and we all know that. But one thing I want you to think about is it's not always about coaching the sets and the reps. It's not always about coaching the rehabilitation exercises. It's not always about coaching what they do. It's about coaching who they are. So I think we lose sight of that a lot with our given professions because we're always caught up in, oh, you got to get, you know, this sets and these reps and these exercises. You got to come in and do treatment. As Juliana was talking, you got to eat this, you got to eat that. Academics, you got to come to tutoring, you got to study. And we don't really take the time to understand our athletes as individuals. And it's important to do because, as the quote says at the bottom, the athletes really don't care how much you know unless they know you care about them. And I'm going to talk about with you guys today ways that you can get to know your athletes. So why is it important? Every year there's a new group of student athletes that comes to campus at Baylor University. And it's up to us to take the time to get them to buy into our programs and what we do. And athletes won't buy into what you're doing until they understand that you care about them and that you earn their trust. And the way that we can earn their trust is by getting to know them. You got to take the time to sit down with your athletes, take the time to talk to them, take the time to ask them serious questions and really listen to them. I think we fall short of that a lot because a lot of our athletes may think that what they're telling us just goes in one ear and out the other. That because we only care about developing them on their field of play and their sport. But at the end of the day, you'll get your athletes to buy into what you want them to do if they're able to trust you. And I'm going to talk about the tactic that I learned from the book, Everyone Communicates, Few Connects, by John Maxwell. It's a really good book, and he gives a short synopsis of a technique used to learn about individuals in a short amount of time. Now, I picked this up at an NSCA conference while I was a graduate student from Dr. Brian Mann, who at the time was a strength coach at the University of Missouri under Dr. Pat Ivy. And one thing Dr. Pat Ivy always told these guys was, it's not about what we do in the weight room, it's about how we develop these individuals as people. And I think that's something that I credit myself with doing a really good job at, combining both of those tactics. So, the formula. The acronym given is FORM. And the importance of this acronym, and I'll talk about what each letter stands for later, is that people will talk endlessly about this information. This is something that's concerning them that they want you to know, and they can talk on and on about it. The acronym FORM gives you a game plan on how to connect with athletes in a short amount of time. Within these four things, you can find commonality between yourself and the athletes, and that'll kind of break down some barriers that they have against you coming in or you with them coming in, and allows you to build that level of trust. So the first one I want to talk about is family. Who are the individuals that were influential in their lives? You know, ask your athletes about their parents. Sometimes you'll get a good message, sometimes you'll get one that's not so good. But it's critical that you know that about these athletes, because one, you'll understand how and why they act a certain way. You know, for example, as a male strength conditioning coach, if I had a female athlete who didn't really have a dad involved at home, she may not trust me as a male strength conditioning coach. And I need to know that, because I need to know how can I effectively coach this athlete. I need to understand that what she's thinking about me as an individual, and relate to her that, you know, I might be something completely different. I'm not who that person was at home. I'm somebody that wants to help her, and somebody that wants to allow her to grow into the individual that we want her to be. And this also will give you a good insight on how a person best receives information. It may not have been that their family was an individual that was really influential in their lives. It might have been a teacher, it might have been a coach. So you can possibly reach out to those people and ask them, you know, how did you reach this athlete? What can I do here now at Baylor University that you may have done in high school or in growing up that allowed these athletes to be successful? The next one, occupation. Now, first thought is these kids don't have a job, they're student athletes. But I think you should look more into it. Well, what is their major and why did they choose that major? You know, ask the questions, what do you want to do post-graduation, post-college athletics? Because a lot of times student athletes don't really believe that we care about them outside of their sport. You know, because at the end of the day, we do have to win games, but we also have to develop champions for life. So being aware of what they want to do, why they want to do it, and allowing them to express that to you will kind of give you a better insight on, you know, how this person kind of ticks. Another thing about occupation, although we all work within our respective realms here, we have a network of individuals outside of what we coach. So if my athlete, you know, wants to get involved in the financial planning industry post-graduation, I may know somebody that I can connect them with. So you're affording them the opportunities of internships, you're affording them the opportunities of shadowing other individuals that you may know for life after college athletics. The next one, recreation. What are they into outside of the realm of sports? You know, what are their hobbies? Hopefully they have an outlet to get them away from sports, at least for a little bit of the time. You know, what kind of music do they listen to? What are their favorite restaurants? Getting to know these little things about an athlete means a lot to them, because it shows that you care about their personalities. And this one is a really big one, because a lot of times as coaches, we may not have the same interests as our athletes. But if you get outside of your comfort zone and want to learn about something that they enjoy, or want to go visit a restaurant that they love eating at, you can do that. And then now you have a common ground to talk about something with them. Lastly is message. What is it that drives this athlete? What are their goals? What are their ambitions? This one, sometimes an athlete may not have a really good idea of it. Others, they're really concrete in knowing where they want to go in life. And I think one of the biggest things with the message part of it is, if they don't have that figured out, you can be an intricate part in allowing them to help them figure that out. And I think that really stands out to them, again, because it shows them that you actually care about them outside of sport and you want to see them be successful in life. So, the better professional relationship you have with your athletes, the more they're likely to buy into what you're selling. And one thing about me, I hate not being able to reach an athlete. I really do. It eats me up inside. But I really have to understand and know that I'm not going to be able to reach 100% of these athletes. But here at Baylor, I think we have a team of individuals who, if I'm not able to reach an athlete, I can rely on somebody else that can. As you see at the top, together we're stronger, our voice is louder, and the synergy of our actions more powerful. And I firmly believe that. It takes a village to raise these student athletes. And the care team that we have here at Baylor is one of the best. So that's where I want to finish. Again, you never want to give up on an athlete, and I never will. But if I'm not able to get to them, maybe one of you guys in this room will be able to. And we have to work together because, like I said earlier, we want to prepare our athletes to be champions of life, and it's going to take all of us. That's what I want to finish with. If I didn't get your picture in here, I'm sorry. But thank you guys for your time. Does anybody have any questions?
I got a question, Coach. Let's say you got an athlete at some point in your career where you were tasked with them. Maybe you were working with their position group. They're in your group somehow, and you just can't connect. Mm-hmm. But you're tasked with keeping up with them. Yep. What are some strategies you've used?
Two of the really big ones. One, as much as you're gonna try yourself, you may eventually have to ask the athlete, what can I do to help you? Like, I've given my best effort. Like, I put my best foot forward, and I'm really trying to reach you, but I can't. So let me know how I can. And that gives the athlete a sense of ownership in it. They a lot of times athletes don't want you to tell them what to do. And that kind of gives them a little bit of control in the situation, so they're more apt to, all right, let me let a little bit of myself open to this coach. Another tactic that I found beneficial is you may not be able to get to the athlete, but you may be able to get to the individuals who are friends with this athlete. So you want to create and build relationships with those people, and that athlete will see, oh, he's not such a bad coach. Maybe I should give him a chance, because if the individuals that they associate themselves with a lot trust you, they're more apt to trust you.
Yeah, I like that. Yeah.
Any more questions? What's up, Coach?
How have your tactics changed? You're a pretty young coach, but each year you get a little bit further removed from being a player. So it's coming right out of being a player. You're a little bit more familiar with socially where everybody's at that standpoint. Now, as you get each year removed, how are you changing your message or changing your approach?
I think the biggest thing in changing my approach is kind of staying up to date with what they do. Like, I really try to find out what interests them. And like I said earlier, even if it's something that I'm uncomfortable with, I put myself out there and I make myself vulnerable so that I can learn what makes them tick. It's something simple as the type of music these kids listen to. Like, a lot of it I really wouldn't listen to, but hey, they play in the locker room, they listen to it in their headphones, but let me see what they're listening to. Let me see why they're listening to it. And that's, that can help you establish a common ground. So I think it's more so finding what the athletes are interested in, what makes them tick, how they operate, and kind of making myself conform to them. I can't be a stubborn individual and think that my way is the right way all the time. Sometimes you gotta swallow your pride and just be humble and knowing that, hey, maybe if I look at it from their perspective, I'll get to them more effectively. Cool.
How do you handle somebody that doesn't take criticism well? You built the relationship with them, you feel like you know him, you guys are good, all of a sudden you're trying to develop them, you criticize him to get him better, you're trying to do what's best for the athlete, but he doesn't take that well. He gets in the tank, he's mad at you, he holds a grudge, he doesn't want to talk to you. What's your experience on handling those situations?
I think my experience as a student athlete helps with that, because I've had to take criticism before, kind of put myself in their shoes and allow them to know that I've been there, Like, I'm not attacking you, I'm relaying this information to you so that I can help you. Because in life, you're never gonna always be right. You have to learn to accept the constructive criticism. I think that's the biggest thing, is you allowing that athlete to know that this isn't to tear them down, it's to help build them up. And it's gonna take time. They aren't gonna go from rookie to all-star in a day. And it's gonna take all those steps in between. So just allow that athlete to know that what you're doing is not to be deconstructive to who they are, but you wanna help build them up. More questions? Thank you, guys.
All right, thank everybody for coming. Couple little announcement deals. Remember, like on Wednesdays at 12:30 down in the Applied Nutrition Lab, we do kind of do a little bit less formal thing similar to this. We have some people talk. And I think the biggest thing with that is there's a lot of cool people in this room with a lot of great areas of expertise. Oftentimes in our profession, we're challenged, hey, go to this organization, join this crew, go to this conference. But there's a lot of learning that can be done here. So look to people like Juliana, like Corey. I mean, we can learn from everybody in here. So that's on Wednesdays at 12:30. Our next one will be November 8th in here. So RSVP, hit me up there, and we'll make sure you have a lunch. We're working on bringing out our AMS software by Catapult. AMS stands for Athlete Management System. Basically, it's a data warehouse that we can use to communicate with athletes and bring all departments together. So it's going to streamline a lot of things that we do, and we're going to have a really neat little presentation for everything. So bring a friend, and we'll really work to demo that. Thank you, everybody, for being here. If you did not eat, make sure you grab it. Thank you all.